All right, welcome back. We're talking all things about teeth, and we're going to continue our conversation. So we talked about children and things of that nature. Talk about when children should expect their first adult tooth, which is pretty exciting.
Pretty exciting indeed. Sometimes comes with pain for the kid, but around 6 is when we expect the child to pretty much get what we call your 6-year molar. That's your first big person tooth typically, and then after that, you start to get your front teeth, your incisors begin to come in. Children, so pretty much from 6 to about 12, 13, you expect to be losing teeth. There gets kind of like a little period between maybe like 10, 9, 10, where you don't lose any teeth for a little while, and then it kind of picks up really aggressively towards the end. You start getting your premolars in around that 11, 12, 13, and your canines around that age. So I get a lot of parents coming like, why is my son still losing teeth? I'm like, it's very normal.
Yeah, absolutely. So we talked about children. Let's now talk about adults. What is the top dental concern there?
I would say it ranges. I definitely see someone every day coming in for some sort of pain, whether that's cavity related pain, whether that's, just whatever, some sort of pain that needs to be addressed, whether it's a filling, whether it's an extraction. Pain is definitely number one due to some type of cavities. And then there's a lot of other concerns that arise. There's cosmetic issues. People don't like the spaces of the teeth or the alignment of the teeth. There's some people that come in with TMJ disease or, in the joints of your jaw having some pain and issues there. A lot of people right now want whitening. Whitening is the hot thing. Um, so I think that ranges. I've seen a lot of people wanting Invisalign lately, and I've been doing those a lot in my office, by the way. Um, so yeah, that's been something that I've been enjoying kind of addressing is giving people new smiles and kind of transforming the alignment of things.
Very, very nice. Well, we have a lot of questions coming in, so I want to give you the chance to answer some of them. Here's one. What is the best toothpaste to buy?
So again, there's a wide range, depends on some of your needs. My favorites are Crest. And I don't want to plug them too much because it's not like they sponsor me or anything. But I do love Crest. 3D White is a really good one, and Crest Gum Detoxify. Those are two of my favorites. Everybody wants something to make their teeth whiter right now. Like I said, it's a hot topic. So that 3D White is really good for that. And Gum Detoxify is really good because a lot of us aren't diligent enough and taking good enough care of our gums, and the gums support your teeth, right? So the stronger, healthier your gums, the more longevity you can potentially have from your teeth. So those would be two of my favorites.
Someone said, do we have to have our wisdom teeth removed?
Again, depends on the situation. A lot of times, because of our anatomy and things, there's not enough room for the wisdom teeth to come in. So a lot of people have them coming in at angles, that are just not ideal. A lot of times it'll compress on other teeth. It'll, cause pain that radiates up to your ear. Sometimes they're back there sitting on your nerve. Sometimes they're back there with a little piece of the gum hanging over and that gets stuff trapped. So everybody's situation is different. There's no necessarily age limit. You can be 50 and now your wisdom teeth are bothering you and now we need to get them out. I would say if I had to put my finger on it, about 70% of people probably would benefit from having their wisdom teeth removed.
Nice, nice. Dr. Johnson, here's another one. Is organic coconut oil good to brush your teeth with for brightness, to fight bacteria and infection of the gum?
Some patients come in and they say they use coconut oil, they say they use clove oil, say it helps with their pain and it helps with gum inflammation and things like that. And there's benefits in those minerals and in those products um, to fight inflammation and things like that, yes. But nothing that we study, no literature recommends those things over, regular toothpaste. Um, and nothing is going to substitute coming in and seeing your dentist, right? Getting those exams and getting those checkups. So while some people may say those things work, I personally don't try it. I'm just going to recommend good old regular fluoridated toothpaste. It's not going to, poison your brain and make you lose your mind. So if possible, I would just stick to fluoridated toothpaste as much as you could.
How can I whiten my teeth from coffee and tea stains?
So biggest thing I tell people is when you drink those coffees and those teas, right? One is going to help you if you're not sipping on it over a long duration. If you have your coffee at 8 a.m. and you don't finish it till 11, well, you've just been bathing your teeth in staining coffee for hours, right? So obviously, not saying chug your drinks, right? But limit kind of the time that you're exposing your teeth to what's causing you the stains. In addition to that, after this coffee or after this tea, following it up with some water, rinsing
Mm.
some of that stuff out your mouth is always a good idea as well. Um, Cutting back on it, of course, would be a good thing. And again, coming to see your dentist because my hygienist, shout out Christy and Ezra, do a fabulous job of removing stains. So they can also, do that for you.
I have a question. Jumping off of coffee and tea and things of that nature, I've heard, I don't know if this is true or not, this is why we have you, that a straw helps, like drinking through a straw instead of just drinking straight from the cup. Can you speak to that?
It does. So drinking straight from a cup, you have less kind of control of the flow of the beverage. We're getting very specific now, but you're essentially funneling it, directly to where it goes. Versus drinking something out of a cup in the waterfall, it has the potential to kind of contact everything, just kind of be in your mouth. But if you're going straight from the straw to swallowing your beverage, whatever it is, then yeah, it does have less, I guess, impact or less like, let's call it splash time on your teeth.
All right, we'll pause here again. We're going to continue answering all of your dental health questions right after the break.